Hello friends, today I will discuss with you regarding one of the patients whom I recently managed. It was a 45-year-old person who came with a history of severe muscle pains, cramps, muscle spasms, and these have been occurring for the last about 2 months. And he was quite troubled because of that. He had also become irritable and he had sleep disturbance, and he also complained of generalized weakness. So with these symptoms, he consulted his general physician, who ran through some blood tests and also examined. He couldn't find much, so he treated him with muscle relaxants. And but that patient did not have much improvement. And because he also had irritability and sleep problems, so he was referred to a psychiatrist. So psychiatrist also thought that maybe because he's suffering from job related stress and anxiety, so he was given anxiolytics and low dose of antidepressants. But the patient failed to improve. At this point of time, the patient also wanted a neurological evaluation, so he came to me. I reviewed the history, and then definitely most of the things were done by the previous doctors. Nothing was obvious. When I also took a detailed history, then the only thing significant I got in the history was that he was taking proton pump inhibitor, omeprazole 20 mg per day, for the last 1 year. When I asked him for what purpose, he said he had gastroesophageal reflux disease (GERD), for which the doctor had prescribed him this medication, and he had asked him to take for 4 to 8 weeks. But he was scared to stop this medication because he was scared to get symptoms of gas and acidity. So he continued this for the past 1 year almost. So now I knew that what I was dealing with. So immediately I asked for a blood test, and you are right, the blood test was for serum magnesium, and it came out to be very low. It was 1.1. The normal level is 1.7 to 2.3 milligrams per deciliter. So now I started him on magnesium supplements, and I also told the patient to stop omeprazole. And then with that, he returned home. And after 1 month, when he came for follow up, he told that, doctor, I'm slightly better, but there is not much improvement. Improvement maybe 10 or 20%. And then when I saw the blood test, again it was magnesium had slightly improved to 1.4, but again nowhere near normal. But the patient accepted that he was scared to stop omeprazole, so he had continued taking it. So then again he required a lot of counseling. So I told him, see, definitely if you have to get better, in addition to magnesium supplements, you have to stop the root cause of this low magnesium, which is omeprazole in your case. And then we'll substitute with if you develop any acidity symptoms, we'll substitute with other medications like ranitidine. So with that he accepted, and then after 1 month when he returned, he was very happy. All his symptoms of muscle pain, spasms had improved, totally gone, and he was able to sleep properly, and he was feeling strong also. And again, magnesium levels, when we checked, it was normal, around 2, which is a normal level. So the message I want to highlight here is that proton pump inhibitors, they are one of the most commonly used medications. If they are used for short term, generally they are very safe, and also if it is used along with the doctor's prescription, again it is safe. But if somebody is taking omeprazole or any other proton pump inhibitor for a long time, say especially more than 6 months, then it can lead to certain deficiencies. And in that, there are common deficiencies. It can lead to vitamin B12 deficiency, sometimes vitamin D deficiency, vitamin C deficiency also, other minerals like phosphate, zinc deficiency, in this case magnesium deficiency. And this alert was also raised by if earlier by agencies also, that if a person is on long duration proton pump inhibitors, we should check serum magnesium, especially if these symptoms are there. So the message I want to highlight here is that if you see a person who has muscle spasms, muscle cramps, and he has been on PPIs for long duration, suspect hypomagnesemia, that is low magnesium levels, which could be the underlying cause. And the treatment involves not only magnesium supplements, but we have to also stop the offending PPI for the patient to get complete relief from the symptoms.